Thank you for joining us for our November e-learning event today with Community-Based Research Canada. Today we are, oops, my slide just got off track there. There we go. Today we are talking about applying participatory evaluation to support community-based approaches for substance use prevention. So we have Tanya Halsall and Matt Dravenstadt here with us today to talk about some of the research they've done in this area. This is part of our series looking at community-based research excellence. In this series, we've been highlighting the winners and the honorary mentions from our awards program in 2025. So Tanya was honorary mention for a emerging community-based researcher. And I'm sure we'll see through the presentation and the work that Tanya's done why that title was very well deserved. As we start today, I just want to acknowledge that the Community-Based Research Canada Secretariat operates from the traditional territory of the Anishinaabe, Haudenosaunee, and Attawandaron, or neutral peoples. Our offices are located out of the Wilfrid Laurier University campus, situated on the Haldimand Tract. The Haldimand Tract is a tract of land that includes 6 miles on either side of the Grand River. This unceded territory was promised to the Six Nations of the Grand River in the Haldimand Treaty of 1784. We give thanks for the privilege to work and for myself to live on this land in Waterloo, Ontario. Community-Based Research Canada, we're committed to continuing to build relationships with First Nations, Métis, and Inuit people throughout Turtle Island. We see this as essential to our work in community-based research, and we aim to promote research projects and approaches that actively work towards reconciliation. If this is the first Community-Based Research Canada event that you've attended, I'll give you a brief introduction. Community-Based Research Canada is a national nonprofit organization. We're a membership-based organization with a mission of advancing community-based research excellence in Canada by strengthening partnerships, building capacity, mobilizing knowledge, and championing community-based research among individuals, communities, and institutions. We are a social enterprise with no core funding, so we're entirely funded by the over 70 organizational or institutional members that we have, as well as our individual members. And as part of the programming that we provide, we host events like today's live discussion or e-learning event, as well as a monthly community of practice. You can explore our website, and I'll put the link in the chat in just a moment to find more information about our upcoming events, as well as recordings of past events and other things related to CBR Canada. So our agenda for today's event, shortly I'll pass things over to Tanya and Matt for their presentation about this project that they've worked on. We'll try to save at least 20 minutes at the end of the presentation today for question and answer period before we close out. So I'll encourage everyone, if you have any questions at any time throughout the presentation, please put them in the chat box. We're not going to expect Tanya or Matt to respond to those as they're presenting, but that way when we get to the question and answer period, we have those questions ready, and I'll start by asking any questions people have put in throughout the presentation. We will make sure we wrap up and get everyone back to their day right at 1 o'clock sharp in Eastern time today. So without further ado, I will pass things to Tanya Halsall and Matt Dravenstadt to share their work with us and introduce themselves to everyone.
Thank you, Amanda, and good to see everybody. I'll just share my slides here. Okay, there we go. Yes, so thank you so much, Amanda, for having us and CBR Canada. I'm Tanya Halsall. I'm a scientist at the University of Ottawa Institute of Mental Health Research, also affiliated with the Carleton University. And I'm here with Matt, and we'll introduce ourselves a bit more in a couple slides. So today we'll be discussing our work around the Icelandic prevention model. So primarily participatory evaluation and focusing on how the project is implemented related to our partnerships and community, and in particular, also the processes related to youth engagement. I figured talking more about evaluation might be more of a niche area since folks are all doing this kind of work in this network. But before I get started, I just want to say first, thanks to everyone for coming. Thank you to everyone in my lab who's contributed to this work, our funders, and of course, our community-based partners, including Matt and the Students' Commission. And so I'm actually in Ottawa. So I'd like to acknowledge that I live and work on the traditional unceded territory of the Algonquin Anishinaabe peoples. And just to give a little bit of background about myself before we start talking about our project. So I've been doing work in child and youth development, child and youth mental health for, I guess, about 20 years, a little over 20 years, I think. And most of this has been in applied context with community partners. And so, my origins actually were with the Knowledge Institute for Child and Youth Mental Health, which was called the Ontario Centre of Excellence when I was there. And that organization was focused on making the child and youth mental health system better. And the way that they did this was through supporting collaborations, knowledge mobilization, and evaluation capacity building. So this was really drilled into me from my early days. And you wouldn't call that community-based research, but the principles and practices that we were using really formed the foundation for the work that I do as a researcher, and really always revolves around participatory work, collaboration with other folks, and coming to sort of common ground and supporting systems change. So figuring out how our collaborations can make practice better. And so I'll pass over to Matt.
Thanks, Tanya. Hello, everybody. My name is Matt Drabenstadt. I work with the Students' Commission of Canada. I'm a researcher, and I also have the privilege of working within the Center of Excellence for Youth Engagement Network, the academic arm of the Students' Commission. If you've never heard of the Students' Commission of Canada, they're a national youth nonprofit that is focused on turning youth voice into action and changing their lives, the lives of their peers, and the lives of their communities and systems around them. And if youth have a voice in something, if youth are passionate about something, you will find the Students' Commission there. I overlook a couple of different research streams within the Students' Commission of Canada, mental and holistic health, as well as substance use and prevention, and thinking about how youth programming is an engine for upstream community work in communities coast to coast to coast. I'm joining you today from the lands of the Osage and Wyandot peoples, and have the great privilege of playing and living and working here. Um, I love my job. I won't spend too much time talking about my love of my job. But I get to listen to thousands of young people and also adults and people who are closest to young people. And I get to weave their voice as a qualitative researcher into something that can create meaningful change. And something that I'm doing and the Students' Commission is always doing is trying to figure out how we wedge youth voices at the center of meaningful systemic change. And I'll just also note that we work very hard to find the voices that are in the furthest corners, the voices that are furthest from opportunity, and how we get those voices to be involved in change in upstream work is a whole separate piece. But I'll just note here that that's a very important part of our work as well. And I'll pass it back over to Tanya.
Thank you, Matt. Yeah, and I think a bonus of doing this for so long is I've got to accumulate lots of nice people in my partners like Matt and the Students' Commission. So I'm also very fortunate in my job. Um, So just to give you an overview of the content that I was wanting to cover, so we will look at some frameworks that we've used in this research, but that I also use more broadly. We'll describe in particular this project, which is based on the Icelandic prevention model. And it's a little bit of a complicated project and is evolving over the years. So it might seem like we're talking about many disparate things, but this is all, essentially about upstream prevention of substance use and many communities' learning process in this work. Yeah, and more specifically, we will talk about the partnership process around working with young people and the nuance of working with this stakeholder group. So I wanted to start with some stuff from Michael Quinn Patton. I am also a qualitative researcher like Matt, and so this is what I was introduced to in my early days, and it was such a strong foundation. He's such a practical researcher, and I think his work, I didn't realize how important it was until, experiential learning in hindsight is 2020. You realize, how things end up if you don't apply these kinds of approaches. And I think probably utilization focused evaluation, which I've used with some projects in the Icelandic model, like New Brunswick, we've explicitly used it. In Lanark County, it's developmental evaluation, but that uses utilization focused principles as well. But this is a staged approach to evaluation where you're very intentionally engaging stakeholders in defining your objectives. And so the premise is that if you want people to use your findings, you should ask them what's useful first. And you build your project from there. And this also nuances what data collection you're going to be using that is feasible and that will work practically within your timeframes and within your context. So it's a very context-rich evaluation framework. And, I don't always follow rigidly these steps, but certainly having an iterative check-in at important points along your project are fundamental. And anyone who is not working in evaluation, I think this framework still is a practical tool that can be used within other kinds of contexts. So there's lots of takeaways. Similarly, a lot of the work that I do and that we're using with the Icelandic prevention model uses implementation science, which has a huge amount of overlap with evaluation. And I know evaluation, depending on what discipline, what context, isn't certainly rarely interpreted as research. You're looking more at performance measurement or monitoring or quality improvement. But I find it gets very, very close to implementation science if you have a strong theory-driven program that, essentially is a real-world application of evidence. And so we also use a lot of tools and frameworks from implementation science. This particular example is from Ian Graham. It's actually a later iteration of his knowledge to action framework, which I think is a very, very famous knowledge translation model. But this one I find very much has a similar approach flow to utilization focused evaluation, where older implementation science models were much more pipeline, bench to bedside. These are very interactive, context, grassroots, informed projects, which I think, many implementation science models have evolved to have much more of that element to it, recognizing that it's necessary if you want people to apply this evidence. There's practice-based experience. There's many other factors at play that need to be accommodated and considered. And so my work uses a lot of these frameworks. And I should also give a nod to, I've always drawn from indigenous methodologies in participatory approaches. I think those are excellent and often the most, I think, evolved, sophisticated ways of doing this work. and also draw from youth engagement like Hart's Ladder and Sabo Flores, sorry. And so the last model framework I'm going to show you, which again is very similar to the previous two, they all have, their own specific ways of implementing, but the Icelandic, so this is essentially the 10 steps of the Icelandic prevention model. And very similar to utilization-focused evaluation, you are bringing community together in the earlier steps. You're identifying champions. You're, sort of looking at asset mapping or needs assessment, examining what partners can or should be engaged. You're fundraising and creating sustainability plans. And then essentially you're collecting data on an iterative basis to inform community goal setting. And so the Icelandic prevention model is specifically focused on youth substance use prevention. And so they collect a school-based survey that looks at risk and protective factors that influence substance use and other developmental trajectories. This model applies a primary prevention approach. So it is essentially about changing context or changing social norms. Another principle is that you always engage schools. They're a major partner in the survey, but also certainly a major developmental context for young people. It's evidence-driven, interdisciplinary, and keeps the focus on population-level kinds of changes around community-driven interest. So whatever the issue is that's identified by the community, the approach is meant to scale the interventions so that it can address that issue. So this comes from Iceland and has been implemented in Iceland for about 25 years now, 26 years maybe. And they've had a lot of success in engaging many communities. And these are national data from grade 10 students in Iceland. So the red line is essentially intoxication rates over the past month. And so in 1998, 42% of their population were getting drunk in the past 30 days. And this was reduced to 6% in 2023. And so, this helped them to achieve really multi-level comprehensive interventions through community engagement. And this was why I became so interested in the model in the first place. So the first community to implement in Canada was Lanark County, and I've been working with them since 2019. When you look at the supporting theory of the Icelandic prevention model, I think, the bioecological model, Bronfenbrenner, social ecological models really fit because these are comprehensive approaches. They do look at policy, they do look at school, community, family indicators to inform interventions. And so it is a very holistic view of developmental context and how you can influence them. Traditionally, the Icelandic prevention model has not involved youth in design. And in Lanark County, and certainly in other communities that were, I think, more experienced in using youth engagement, they integrated this within their approach. And there's quite a few adaptations that you see in going from Iceland to Canada, as well as other international contexts. And so we've been doing the youth engagement work since around 2020, I think. It's also evolved. We went through the pandemic. There's been different funding cycles. Young people sort of age out of out of school or out of whatever context they're in. And so we've had different young people involved at different time points. But essentially we used this model, which actually comes from the Knowledge Institute. It's from a publication, Ready, Set, Engage, and actually I can share that, but it's also in one of the links that I gave to Amanda. It takes the Hart's Ladder, which has 8 rungs. So it takes the top 5 rungs and it makes it circular because sometimes I think people recognize youth-led as being automatically the very best way you can approach initiatives. And with a complex intervention like this, you're never going to have a youth initiated and directed. Like there's always either public health is often taking the lead, or sometimes you'll have, a child and youth and mental health organization. There's always an adult who is bringing young people in within the community. And so youth adult partnership is really more ideal in this kind of complex system level work. And so we had a youth advisor who was involved with the steering committee for several years. We also had working groups that were very closely supported by the Students' Commission, which was the adults initiated and shared decision making. We did the asset mapping with them for that component of the work, and then consulted and informed. We've done consultations both through community interviews, but also a youth summit and focus groups to identify from young people what kinds of changes do you want to see in your community. A key piece of having young people involved in these projects, I think, as with adults, it's important that those young people sitting at decision-making tables have the capacity to engage with these key decisions. So, they're talking about budgets and conflicts of interest, politics, fundraising. These are not, I work on some projects with kids in kindergarten. It's hard to get through a consent form with that age group, let alone, an hour-long meeting talking about these things, once a month. And so it's an important piece, I think, that you think about the capacity of the young people and how closely they're engaged, and have multiple levels of involvement based on capacity and based on interest and availability and things like that. So, what started in Lanark County has expanded immensely. The Public Health Agency of Canada has been interested in this work. I'm not exactly sure when it began, but the Chief Public Health Officer's report in 2018 talked about the Icelandic model and the importance of prevention and substance use. At this point, I think there's definitely more than 20 communities, I think, implementing in Canada. And the federal government in the 2023 budget invested a little over $20 million, which created the Youth Substance Use Prevention Program. And the KDE Hub became involved as a key partner in support in implementation. And the Students' Commission came on board at that point. And this is done in collaboration with Planet Youth, which is the Icelandic partner who essentially implements the survey component of each project. So the Youth Substance Use Prevention Program, which was launched in 2023, late 2023, I believe, has similar principles to the Icelandic model. And certainly the intention is to implement the Icelandic prevention model, recognizing that Canada is a totally different context. And so more emphasis on health equity, more emphasis on cultural adaptation, and youth-centered approaches were a key piece of this work. And so Matt's going to talk a little bit about his role in supporting this national project.
Yeah, thanks, Tanya. So the Students' Commission of Canada has partnered with the KDE Hub, and I do see some KDE Hub folks here. And I'll just say the KDE Hub is such a wonderful resource and place for, yes, there's a thumbs up. That's great. Huge shout out to the KDE Hub. They're phenomenal for partnering as well as mobilizing knowledge at a national scale. But I'll just comment on one piece of that. So we started a working group around youth engagement. And as Tanya mentioned, youth engagement is a piece that's present, but a little underpowered if you look at the Planet Youth framework and the Icelandic prevention model. So how do we boost this piece, this component of bringing young people to the table and recognizing them as valuable stakeholders throughout this process? So we started a working group and invited the Canadian YSUP projects, that's the acronym, for communities working in Planet Youth across Canada, and had a massive turnout of interest. And we've had 2 meetings so far. And I've had the privilege of sitting down one-on-one with a lot of these projects to have a sense and a pulse of where they are in their youth engagement. What are their hopes and dreams? What efforts have they tried thus far? And trying to weave that as a collective into something that can guide youth engagement in this process moving forward. So we have very much a practical focus for this working group, as well as a research interest as well, in understanding the process of becoming in this youth engagement component. And it's really wonderful, the diversity of experience and expertise that show up to this table. We have folks who are working in the Indigenous parallel of Planet Youth. So some amazing stories coming out about how youth elders are being used in this process, as well as a lot of people starting from scratch. And uh, two observations about this group in getting to spend time with them. One is everyone is saying youth engagement matters. Everyone is like, we are so on board. We've named things with youth engagement involved, even though there's no youth there yet. We want youth there, but everyone showed up to this group with the same singular word question, which is how? How do we do it? How do we make this happen? So this, you'll see there's a little snapshot here. This is a snapshot of our digital whiteboard from our last meeting. There's lots of stickies and there's lots of ideas pasted across the Icelandic prevention model. And we're going to be distilling this into something that is concrete, that both the Canadian Planet Youth and Icelandic prevention projects can use, as well as scaled. So go ahead and hit the next slide for me, Tanya. Thank you. So I just want to provide a little bit of backdrop into what is youth engagement. So back at the turn of the century, the Center of Excellence for Youth Engagement coined a leading definition of youth engagement, which is it's the meaningful and sustained involvement in an activity with a focus outside of the self. And once this definition reached the research bubble, it started to shift the language globally, even around how we talk about youth being involved. We're seeing this framework in South Africa, India, Costa Rica, around the world. And one part of this definition that I think is really prevalent in community-based work is this focus on bigger than the self, being involved in something bigger than you. And that is such a need right now. I'm a suicide preventionist. That's my like heart of hearts passion. And being involved in something bigger than you is such a leap out of isolation and loneliness, which I feel like is an epidemic we're living through. I'll highlight a couple of pieces of our youth engagement framework. Youth engagement is holistic. We talk about youth engagement of the head, of the heart, of the feet, and of the spirit. What are young people learning as they're being involved? How is this making young people feel? What are young people going to do with what they're learning and how they're mobilizing their initiative and momentum in community? And then this piece around spirit, we initially just had this triad of engagement: head, heart, and feet. And from the indigenous communities, they said there's something missing about engagement. There's something that you haven't covered yet in this early framework of engagement. So we've added this piece around connectedness, this piece around how are you connected to culture? How are you connected to community? Um, I'll highlight two other pieces of this framework, just seeing that we're a little strapped for time. Um, Youth engagement works across levels: individual, social, and system levels. So we can think about engagement from the perspective of a singular individual, their world, what they can bring to the table. We can also move into the social and thinking about how young people are enmeshed in different social circles in their community. And we can work at the system level and thinking about how systems are involved in shaping the environment around young people and how young people are a part of those systems. and working at every level, individual social system, there's synergist benefits of doing that and being able to move from the community level to the individual level and having that agility and youth engagement. Go ahead and go to the next slide for me, Tanya. So there's more on youth engagement, and I'm happy to talk more about that. But I also just want to echo something that Tanya's already said around making young people decision makers and shifting the power and shifting the structures around young people so that they can be empowered to take charge. So where are these meetings happening in your community initiatives? Are they youth accessible? When are they occurring? Are they occurring while young people are at school? Or are they occurring at 7 o'clock on a Wednesday when young people might be available? And something that we need to be doing as communities is to raise the complexity of our structures to meet the complexity of need and the messiness of youth living, which is sometimes a challenge. And we have to be working in intergenerational partnership with young people, which is something that Tanya has already touched on. But really working to build their capacity to hold the seat and the power at the table. And I think more than anything, when it comes to youth engagement and giving young people um, power as decision makers over their lives and community, is holding the space for them to be able to share their stories. That's often so much what young people want to do is insert themselves and their narrative into the bigger problem, into the thing that's bigger than them, that they can't conquer without you, without us. So how do we hold that space? The slide here is part of our PAR framework in working in making decisions. I'm not going to go into the specific details, but this is a great resource for working with young people and facilitating decision making. One last piece that I'll touch on in the spirit of intergenerational partnership to empower decision making is the power of relationship. We really need to put that at the forefront of our work with young people. Just asking them how they're doing. So many, like, that's such a novel concept for some um, like some adults are just really uncomfortable asking young people, how are you? But that's so often where it begins in creating these fine-grained connections in this web of relationship that's needed to back and forward youth engagement as a central component to community-based upstream initiatives. And I'll just put this is a quote from our youth engagement working group that I'll just put in the chat for you. Just around like why we need young people. So I'll leave that for you to read if you'd like. And I'm going to pass the mic over back to my colleague Tanya.
Thank you, Matt. And yeah, that framework actually, we've embedded it in other projects not related to substance use prevention. And yeah, I just wanted to jump off of what Matt was saying about relationship building and listening and those stories from young people and, you know, the qualitative element, which of course supports participatory work, but I think also helps you know what you don't know in these projects. And very often there's important pieces of mechanisms or context or some process that's going on that young people bring to the table that really elevates the whole project and makes it more effective. So another thing that the Students Commission does that I think is fundamental to this, and really fundamental probably to all community-based research approaches, they have something called the 4 pillars, which they use with young people when they're doing facilitations to engage them in and key issues and to support them sharing their voice and their stories. And it involves respect, listen, understand, and communicate. And I think this is really the fundamentals of the dialogues that you need within these projects, because a lot of the time, if you don't start with respect and listen, you know, when you're working across disciplines, when you're working across cohorts and age groups and you know, worldviews are quite different and you'll be using different language. And so you need to create that space and make sure that you understand and communicate so that there is back and forth. So you eventually come to a new level of understanding. And I think that really, really is an important piece of working with young people. But good practice, what's necessary for some is good for all. So I really do feel like it's a key process. So we've come to, that's kind of half an hour there. So I had a couple of other slides, but I can save them for another time. But thank you very much. I should have put Matt's contact info on here too. Yeah, I thank you for your attention and your participation. And I'll open the floor, I guess, to questions. Yeah.
Thank you so much, Tanya and Matt. It's fantastic hearing about this. I mean, I'm located at the University of Waterloo and know a little bit of the great work of the KDE Hub, but to hear about the way that you've done the work with them and the way you've woven all these different frameworks together in your project with that focus on youth and participatory research and evaluation is wonderful. So this has been a great presentation. We'll open the floor for questions. I don't see any questions in the chat so far. So if anyone has any questions, now is your chance to please type them in the chat box. We have 20 minutes left to have some discussion with Tanya and Matt, to have some questions that they can answer. And maybe I'll start just with a really practical question. I think there were pieces of wisdom that you've shared throughout the presentation, but if you could each maybe wrap up, the top one or two pieces of advice that you would give to a researcher looking to start a participatory research project that really does authentically engage youth, what would be the big pieces of advice you would give?
I can go first if is that okay, Matt? Yeah. This is just what came to me first. I don't know if this is what I would really, really start with. But I think you have to look at the structure that you're trying to move forward and think critically about what needs to be adapted. Like we just started working on a team grant with the Students Commission again. This is on creating healthy online spaces. And we have a young person who's the named main person in that grant, and you can't like write a terms of reference or an MOU, or like this is a very different way of working. And how do you create this governance where one person isn't affiliated with an organization, they're just them, and they're also not necessarily like, he's younger, he's just moving from adolescence into emerging adulthood. So I think you need to look at those pieces that you need to adapt and adjust and do it ahead of time
Mm,
so that it's not creating these complexities working with young people. And then I think in addition to that, you need to have some concrete pieces for them to look at and bounce their ideas off of so that there can be this slow introduction to things that might be totally foreign to them, and so that it can help them concretely think about the issues you're working with.
mhm. Thanks, Tanya.
Um, one time we did a webinar called "Come for the Pizza, Stay for the Program." So I think one thing I didn't get into in the youth engagement framework is the various components and dimensions of it. So there's sort of five. This kind of answers in part the question that's come up in the chat. There's five sort of central dashboard components to pay attention to in youth engagement, and two of them are really important, especially early on, and that is, what are your initiators? What gets young people through the door, like pizza, for example? And then what are your sustainers? So we've had so many participatory action projects where it's about addiction, or it's about depression, or it's about understanding like community traumas, and we'll advertise for it. We're hoping to get young people together to hear your voice on this particular, people who show up because they're really passionate about that. They're really passionate about houselessness. They're really passionate about addiction, and they really are, they have that lived experience, or they really they're motivated to do something about it. And then if you just say like, there's gonna be pizza, or there's gonna be, like 80% of young people show up because there's food. And then maybe you've also included the free transportation to get to the event. Um, or you're gonna give them honoraria, or maybe you've got free babysitting for younger siblings, or if if we're resourcing those furthest from opportunity with the most barriers. Barriers is one of the other components. How are you breaking those down? And then what we hear over and over again is after young people get through the door of a research initiative, they stay because there was a trusted, caring adult who took an interest in them, and they had a meaningful conversation. And that's the first glimpse of mentorship that they've ever had in their community. And then that's a reason to stay. That's a reason to sustain that meaningful engagement. So I think that's a really critical axis to pay attention to in your early work with getting young people to the table is thinking about the program qualities. That's one of the other components. What are the program qualities that are going to nurture this engagement?
Mhm.
And as a belonging researcher, the connectedness of it all is something that I pay attention to.
Yeah. Thanks, Matt. I think both of you shared some really important pieces of advice there, thinking about youth engagement, not just within research, but youth engagement generally. But of course, all of those principles apply when we try to engage youth in research. Uh, I see there's kind of a three-part question in the chat here. Maybe we'll start with the second part of it, because I think that's aligned with what we were just talking about. How did you measure youth engagement? Did you do any of your own sort of meta evaluation of your own processes or any measurement of youth engagement or indicators related to how youth felt about the engagement processes throughout this evaluation? Oh, we're not hearing you right now, Tanya.
Sorry, I was on mute. Um, yeah, I can speak to the Icelandic prevention model evaluation. So we didn't do an evaluation of the youth engagement process. The youth were involved in the evaluation of the Icelandic prevention model implementation. And so we are starting to get to that point like we did. There's been 2 youth summits that the Students Commission was involved in, and they would have done like conference event evaluations. And there's now an advisory group which has formed. I think they've been working for about a year and a half now, specific to Lanark County.
Mm.
And they are going to be doing an evaluation of their work as well. Um, so I actually applied for a larger grant for the national project. And within that grant, we had wanted to use the youth voice at the agency level to look at evaluation across communities. And we also wanted to use Linda's Head, Heart, Feet, Spirit, or the snapshot tool, which the Students Commission created. Well, not the Students Commission, I guess the Center of Excellence for Youth Engagement. Um, and that sort of looks at how you know how engaging is the work, like are you interested in it, are you passionate about it, is it meaningful. There are a few different elements around, like head, heart, feet, spirit, essentially looking at like how much they're involved, how much they like it, how do they feel when they're doing it. Yeah, so I've used the youth voice at the agency level and other advisories as well, and I find it to be a good tool, although it doesn't fit every context. But in the Icelandic prevention model, the school survey is one of the big data collection tools, which we haven't published on it yet because communities have only had a couple of data collections. Oh, thanks, Matt. We use the quality implementation framework to design the interview guides that we used both with the steering committee. And then we had created an interview for youth advisory, which didn't come into existence during the pandemic. So we just did youth consultations. And I mean, I would say that youth priorities being used to inform the implementation would be a good measure of whether youth involvement was effective. You know, whether they liked the involvement, we haven't captured data about that. But I mean, this evaluation started with a postdoc. So I had, I don't know, like $10,000 or $15,000 extra, and I paid my youth advisor for their honorarium to participate, and then I paid for a couple publications and like maybe going to a conference, and then that was all the money I had. So it started very small, and like it's growing and becoming more formalized. But yeah, like in terms of implementation stuff, I use the quality implementation framework first for that the interviews. There's an evaluation guide that the Public Health Agency published, and I use the active implementation framework. I'm forgetting the exact name of the tool right now, but it's meant to measure ideal versus sort of developmental implementation of specific interventions. I'm now trying to create more fidelity tools, and so like scaling and thinking about the re-aim framework and um, yeah, I mean, when you look at the Icelandic prevention model, it's similar to the roadmap. I think there's many, many implementation angles and frameworks that you can look at to inform the work. But that's what I've used so far. Did I answer all that question so far?
I think so, yeah. You touched on tools that were used in the evaluation. You talked specifically about the frameworks that you used to develop some of the tools. In terms of specific methods in the evaluation, you mentioned interviews. Um, were there other methods that I think you touched on them during the presentation as well, but anything else you would add to that?
No, I don't think so.
Okay. And then you talked about some of the implementation science frameworks that you use to look at the program, the quality implementation framework. So excellent. If there's any follow-up questions in that you'd like Tanya or Matt to expand on, let us know. I see the next question in the chat. Have you found any differences in youth engagement in rural versus urban settings? And maybe to add a second part to that, do you differ your engagement strategies at all for rural versus urban settings?
I'll maybe let Matt respond to that first. He might have more.
Wow, that's a hard question. So I'm going to take a stab though. A couple of things come to mind, one of which is the vital importance of demographics. And so how we translate that for young people is we call it the About You section. And it's actually very, our like platform, we have a research platform called Sharing the Stories, and our demographic section is actually very expansive. Like it is multiple pages asking like various pieces around sexual identity, gender identity, what kind of town do you come from? So where we figure out if they're more urban or rural, um, you know, and we're amazed how many young people fill that out, even though it takes 12 minutes to fill out. And one of the things that we speak to is uh not oh my gosh, the word was, it's a C word, constituency building. and you might be the only young person from your town. You might be the only uh Black queer youth this side of Saskatoon, and your voice in this survey or in sharing your stories, which is how we talk about research, which is an inviting kind of way to talk about it. We found for a lot of young people, um, you can speak to other young people's experiences who might not have the opportunity to share their voice. And that's been very motivating to get the demographics to be able to distinguish urban and rural youth, to be able to distinguish um, young people who might have a higher ACEs score than other young people. So as far as priorities to make in your research game plan, think very hard and expansively about the demographics that matter, and how we've kind of like um, strategized with the aggressiveness of that demographic section is we have like 4 questions that are tacked to anyone registering that are demographic based, and then we provide this optional piece to dive into. So we're still capturing kind of demographics no matter what. So that's just a waving a flag for demographics, and we should gather those. Um, as far as oh God, like altering approaches, I think I honestly think like rural. I want to make a case for rural evaluation. Working with some rural communities right now with Planet Youth, and just a huge asset that they have off the bat. Talking about, so Tanya was talking about asset mapping, needs mapping, asset mapping, um, is the interconnectedness of the community. And this person knows this person, and everyone, the 6 degrees of separation kind of smashed down to 2 or 3 degrees, depending on how rural we're getting. And one thing that especially rural and remote young people have told us post-pandemic is, everything shifted to the virtual in the pandemic, and then there was a big push to like get rid of the virtual. We want to be in person. And the young people who were highly engaged or wanted to be highly engaged from rural and remote settings said, don't get rid of the virtual. You have to hold on to it because
Mhm.
that's how we show up. That's our door in. That's our initiator. So you can like, yes, the in-person matters, but um the virtual really created some pathways for some young people who were furthest from opportunity in removing some of those barriers. So that's one, I didn't really answer your question. That's one trend that we've noticed, that still comes up, for young people is keep the virtual. Please, please, please keep the virtual. Um,
Mhm.
anything to add there, Tanya? Or anything you want to shine a light into?
Yeah, well, I think your point about virtual for me has been, you know, many of my projects wouldn't have existed because, I mean, if there wasn't a way to engage young people virtually, and this goes for both urban and rural, uh, I would say that, you have to go to where the young people are, and that's partly why virtual is much easier for in some ways. But like in terms of the Icelandic prevention model, like we started up during the pandemic. That was when we started our youth engagement work. So it was virtual. And then like the second youth summit, I can't remember how they implemented the first one, but the second one was done during a PD day. So the kids didn't have school that day, and like there wasn't any obvious activities for them to do. So they organized this conference and they got transportation. I mean, in terms of Icelandic model interventions, a lot of it focuses on extracurriculars. And so the rural aspect really comes into play around how do you overcome transportation issues? How do you make sure that like young people who are maybe a bit more geographically isolated can get to these things? And there's been a lot of creative directions around like, changing the school bus schedules. In Iceland, they actually have infrastructures built up all around their schools. So the kids just walk over to the things afterward. The parents don't have to drive them anywhere. And so, thinking about different ways of making sure that I know there's one of the Ontario communities, they've got I can't remember what they call this, like a satellite thing. It moves around to where the young people are. So in terms of like engaging them, I think you have to be creative, both in rural and urban. And
Mhm.
yeah, I mean, with our youngest kids, we're doing one project. We walk around with them at their school and do interviews with photo voice. You really have to get down to their level. So it's really thinking about the particular context that you're dealing with and what you
Mhm.
need to do.
Thank you both, Tanya and Matt. I think, again, you gave some really good insights there into, um, both the idea of engaging youth in terms of the programming, but also engaging youth as co-researchers or research participants and some of the tips there. So thank you so much. We have 5 minutes left, so I'll bring us back together for some wrap up now. I see some folks have said thank you and thank you for the advice, so it's been very appreciated. We record all of our e-learning events in case you didn't get that notice when you first logged in. But we are recording today and we'll be posting the event recording on our website. If you would like to share this event recording with others in your network, or perhaps go back and rewatch it yourself, or take a look at past events we've had at CBR Canada, you can explore all of that on our website there. And we hope that you'll stay in touch with us. If you're new to the CBR Canada network and you're interested in learning more about our upcoming e-learning events or our community of practice, other events that we run, workshop or training opportunities, you can sign up to our e-news. We also in our e-news share news from our partners across Canada. So lots of cool and interesting updates and resources being shared through our e-news from all across Canada and beyond, internationally as well. So I'll encourage you to sign up for our e-news if you're not already. And lastly, I'll encourage you to join us next month. It'll be our final event in this series of celebrating community-based research excellence. And we'll be highlighting one of the research teams that was an honorary mention for our Community Campus Research Partnership Award, the DASH project, Decisions for Affordable Social Housing. So it's going to be another fantastic project that we'll get to hear about in the December e-learning event on December 11th. I've just put the link in the chat where you can register for that event as well. Thank you again, everyone, for your participation today, the questions that you've asked. Thank you so much, Matt and Tanya, for both being here, sharing with us, as well as just for the work that you've done. You're making really important contributions to our understanding of youth health and well-being and programming and how we can implement and evaluate the implementation of these programs. So thank you so much. We very appreciated it.
Thanks, Mata. Thanks, everyone.
I see there's a question about links to research. Yes, so when we post the recording on our website, Tanya sent me a whole bunch of links to publications as well as community partners websites that have been involved. So you'll see that alongside the posting on our website, all of those links that Tanya shared with us. All right. Enjoy the rest of your day, everyone. Thank you again, and we hope to see you again sometime.